Hello YouTube. Welcome to Dr. Vibes, a learning point. In this video, we will study everything about tetanus. First of all, who causes tetanus? So tetanus is caused by Clostridium tetani, which is a terminal spore-bearing gram-positive bacilli. The spores of Clostridium tetani are present in the soil and manure. If you have a contaminated crush injury, contaminated surgical instruments, or this infection can occur inside your body through minor cuts or abrasions in farmers and field workers. So this is how the spores enter the body. The incubation period of tetanus is 7 to 10 days. And if there is latent tetanus, then the incubation period increases. Once these spores are inside the body, they will germinate in the anaerobic media and they will form tetanus bacilli. Now this tetanus bacilli will release two kinds of exotoxins, tetanospasmin and tetanolysin. As the name says, lysin, so tetanolysin will cause hemolysis. And tetanospasmin will affect the 1. Neuromuscular junction, 2. The anterior horn of the spinal cord, that is the motor neurons, and C. The cranial nerves. Now, they will act on the presynaptic membrane on the inhibitory neurons and they will cause sustained excitation. This can hamper the cranial nerves, this can hamper the axial muscles, the respiratory muscles, the CNS, and also the sphincters like your ureteric or renal sphincters. Now we have to see the effect on all these structures individually. In axial muscles, tetanus will cause sustained spasm, and in respiratory muscles, they cause sustained spasm. The cranial nerves which are affected by tetanus are 3, 4, 5, which will cause ophthalgia. If cranial number 5 is affected, that causes trismus. 7 nerve, that is the facial nerve, is affected, it will cause risus sardonicus. If 8th nerve is affected, it will cause hyperacuresis. And if 9th, 10th and 12th nerve is affected, it will cause dysphagia. Now this risus sardonicus is also called as the devil's smile. If your axial muscles undergo sustained spasm, they cause opisthotonus and orthotonus. And if the respiratory muscles sustain contraction, will cause respiratory failure. Lastly, in CNS, tetanus can produce seizures. This drawing which I can see now, that is called as the arching of the body, like a bow, this is called as opisthotonus. And if the man is straight on the ground and the axial muscles have undergone sustained spasm, then that is called as orthotonus. Now, come to the complications of tetanus. First, as it is affecting the neuromuscular junction, there can be musculoskeletal injury, there can be respiration pneumonia because respiratory muscles are failing, the respiratory failure, arrhythmias can occur which can lead to cardiac failure, and there can be toxemia in the body. So these are 5 very important complications of tetanus. Next, we move on to the management, which involves investigation and treatment. So first of all, you have to identify the risk wounds and the individuals from where the tetanus spores have entered in your body. You have to isolate that person and you have to do source control. So 3 things: identification, isolation and source control. Now, for source control, you can give antibiotics like penicillin or metronidazole. The 4th step is neutralization of the toxins. You have to give anti-tuberculin globulin, that is 3000 to 6000 international units in IM route. For symptomatic treatment, you have to give spasmolytics like benzodiazepines, barbiturates, muscle relaxants. You also need to give fluids for autonomic stabilization. You will give alpha blockers, which will cause autonomic stabilization. And for the respiratory comfort, you can give mechanical ventilation or any other respiratory support. Lastly, so you have to prevent tetanus. For that, you have to give tetanus toxoid that is 0.5 ml intramuscular route. I know this video is going long, but as it is very important, you have to bear with me. So, prevention, you can do it in two ways: tetanus-prone wounds and high-risk tetanus-prone wounds. In tetanus-prone wounds, these are the wounds which contain foreign bodies. Or these are the wounds or burns with contamination and sepsis. Or it can be bite. So these three categories lies in the tetanus-prone wounds. Now, in high-risk tetanus-prone wounds, you have heavy contamination of the wounds with the tetanus spores. And these spores have come from the soil or manure. Another high-risk tetanus-prone wounds are the extensive devitalized tissues. Right? The last high-risk tetanus-prone wound can be the wounds that require surgical interventions with more than 6-hour delay. So these wounds you have to keep in mind while you are preventing tetanus. Lastly, how would you do the post-exposure prophylaxis for tetanus-prone wound? 1. If the person is immunized, that is, the person has been given a primer dose and the person has got a booster dose. So the person is more than 11 years of age and got a primer dose and last dose of tetanus vaccine was within 10 years. If the person is 5 to 10 years, a child, then you have to give the preschool booster plus the priming dose. And if the patient is less than 5 years, then you have to just give the priming dose. This is very important when you are doing the post-exposure prophylaxis of tetanus. Now, the second category of the people or the case is the clean tetanus. That is tetanus prone. So as I was saying, the other category is the clean or the tetanus prone or the high risk tetanus prone wounds. And what are tetanus prone and high risk tetanus prone wounds? I've just discussed few minutes ago. In such cases, no prophylaxis is required. Now, the third case of the post-exposure prophylaxis involves if the tetanus vaccine has been given more than 10 years ago, or it has been 5 to 10 years when the patient has got the priming dose, but the patient has not got any school booster. Then, if the wound is clean, then no prophylaxis is required. If the wound is tetanus prone, then one immediate dose of tetanus vaccine is required. And if the wound is high risk tetanus prone wound, then one shot of vaccine is required ASAP. That is, as soon as possible, you give one shot of vaccine. And you also give one dose of anti-tubercular globulin at a different site that is away from the vaccinated site. So this involves the prophylaxis of those patients who have got a tetanus vaccine 10 years ago or have received only a priming dose but no secondary dose. So till now we have studied about what causes tetanus, how the tetanus goes inside the body and what does it do, the symptoms that the tetanus the tetanus Clostridium tetani will produce in the body, what are the complications of tetanus, how would you manage a case of tetanus, and then we studied about the post-exposure prophylaxis. Last category are those patients who have not even received the priming dose. So in that case, if it is a clean wound, you will do tetanus vaccine. If it is a tetanus prone wound or a high risk tetanus prone wound, you give vaccine plus anti-tetanus globulin. This is all about tetanus in very details, and you must focus on the vaccine and post-exposure prophylaxis.